Good morning. I'm Dr. Leonard Marks speaking to you from UCLA Medical Center about a very interesting new treatment alternative for prostate cancer. The history of this new device is fascinating. I'll tell you about it in a few minutes. The treatment is called HIFU, H-I-F-U, High Intensity Focused Ultrasound. It's a technology that's been evolving over the past 100 years. But thanks to industry interest and support, this has come to a fruition recently and has become FDA approved recently, and we are now proudly offering it at UCLA. I'm presenting this on behalf of Dr. Alan Pantuck and myself. We are colleagues who have worked with this since 2009 when we first became involved in this project. And both of us are qualified to do these treatments. High intensity focused ultrasound. First, I want to review with you a little basic information about prostate cancer. 181,000 new cases per year, more than 26,000 deaths expected during the year 2016. This is a very serious cancer, the second most common cause of cancer death in men, just behind lung cancer. For a man born today, there's a lifetime risk of being diagnosed with this of 1 in 7, and about 3 million men are alive today with prostate cancer. Everybody knows someone with prostate cancer. It's a very common condition. Among the risk factors, the only two that bear statistical credence are a family history. If your first filial relative, father or brother, has prostate cancer, then you've got to double the risk of getting it as someone who lacks those risk factors. If you have two first filial relatives, father and a brother, then you have a 5 times increase in likelihood of being diagnosed with prostate cancer. African American men have almost a double risk of prostate cancer, and about that, when they get it, about double the risk of dying from prostate cancer. So it's a very particular concern in African American men. Among the curative treatments available up to now for prostate cancer include radical prostatectomy, radiation therapy, cryotherapy, and now very recently high-intensity focused ultrasound, or HIFU. HIFU came to UCLA in 2009 as a research project. We participated in a clinical trial, and after a circuitous path, it was finally approved by the FDA in October of 2015, less than 1 year ago. And now we have it and are offering it to our patients at UCLA, as I will indicate in one moment. So what is HIFU? HIFU, this is a very nice analogy. HIFU, if you consider the ultrasound source as the sun and the ultrasound transducer is the magnifying glass, what you see here is the analogy. The sunlight is focused with this magnifying glass onto a point and can actually create a fire. If that were a little leaf, it would create a fire there at that little tiny spot where the heat is focused. So this is a matter of heat and cavitation that comes to a point, and these points are very fine. This isn't actually fire. This inside the body, it is but it's a boiling point of tissue, very, very tiny, focused, about the size of a grain of rice. And this is how HIFU destroys prostate cancer. This is an animation which shows how HIFU works. In this diagram, the blue is the prostate. This is the bladder above. This is the HIFU transducer. And we outline the prostate first, capture the image, and outline a treatment plan starting anteriorly. This is going to be done in 2 planes, first to the top, then to the bottom, so that we encompass all parts of the prostate. This is very precise. Precision is the main attraction of HIFU, precision and lack of invasiveness. This is entirely a non-invasive procedure. Beyond minimally invasive, it's non-invasive. Nothing goes through the skin. So here comes the focused point, and we will move step by step through the prostate, ablating tissue as it goes through. Each spot of ablation is about the size of a grain of rice, very tiny, very precise, very well controlled. The FDA approval is for ablation of prostate tissue, and that is exactly what we intend to do with this. As I'll show you, there are two main indications for this. First, men who've had radiation therapy and it's come back, the cancer has come back. This is a very difficult situation. We want to ablate that tissue. Surgery is a very difficult option at that point, but HIFU is a very good option for radiation recurrent prostate cancer. This is an example of the entire prostate being ablated. We can also use this technology for focal therapy of prostate cancer for men who have not been treated before, and we will try to find the spot on MRI and then target it. MRI targeting is a very important part of the HIFU experience. So the evolution of HIFU as a treatment for prostate cancer is very interesting. This is originally began more than 100 years ago with the development of the first listening device, the concept of pinging sound waves off something at a remote location to tell about them. And it was first used for detecting icebergs under the water in the early 1900s. Later, during World War II, a man in France, Langevin, used HIFU for finding submarines under the ocean. In the 1940s, ultrasound first began to be focused. The Fry brothers at the University of Illinois pioneered this for the study of brain tumors. And then in 1994, the first medical HIFU approval was made. It was for prostate. It was in Europe. And so prostate HIFU has been used now in Europe since 1994. And then in 2015, after a 10-year series of research projects and clinical trials, HIFU was finally approved in the United States. The Sonicare Corporation, with their device, the SonaBlate, has gotten this approved by the US FDA, and we now, as I said, are offering it at UCLA to our patients. There's been much usage of prostate HIFU to date. About 15,000 patients have been treated with the exact same technology that I'm describing here. It's been approved by the equivalent of the FDA in more than 40 foreign countries. And interestingly, about 4,000 men from the United States have elected HIFU outside the United States. The laws have been such that it wasn't FDA approved, could not be performed in the US, but US trained urologists could take you to an offshore location and treat your prostate cancer offshore. This came to the attraction of the news media some time ago. Puerto Vallarta was one location of these offshore HIFU projects. Others were located in other places, Canada and Mexico and some of the Caribbean islands. But a lot of experience was gained here. A lot of safety data was gained. A lot of effective treatments were performed. And these are where men from the United States came from to go offshore to receive their high-intensity focused ultrasound for prostate cancer. So there has been a lot of experience both overseas and with our own people. Two current usages for HIFU for prostate cancer. The first is for men who've had prostate cancer that has recurred after radiation therapy. This is what the clinical trial was all about. UCLA was the lead enroller in this clinical trial that led to FDA approval. We treated 16 men here. You're going to see one of them in just 1 minute tell his story. And that's one indication for HIFU. A second indication is for initial therapy for men who are especially interested in focal therapy. Not ablating the entire prostate, but reducing morbidity of treatment, reducing side effects, and trying to just treat the tumor itself. Focal therapy for prostate cancer. HIFU is a great way to do this because of the precision. So our experience at UCLA began when the FDA trial was launched in 2008. In 2009, our IRB, Institutional Review Board, approved this clinical trial at UCLA, and in 2010, our first patient was treated. The trial was completed in 2014, 100 men treated across the United States. We were the lead enroller in this trial, which gives us great credibility and certainty that we can do a good job for our patients, have a lot of experience. The FDA panel hearing was in 2014, later that same year, and in 2015, October of 2015, HIFU was approved for ablation of prostate tissue. Earlier this year, UCLA received delivery of the first HIFU unit in West Los Angeles, and we are proudly offering it to our patients as a treatment for properly selected men for prostate cancer. Let me show you our experience with one of our first patients and what a happy man he is. This is a gentleman from up north who came down to see us and participate in this clinical trial, and we've now got a 5-year follow-up on him that I'll tell you about after the video.
Dwight Baird is about to undergo a new non-invasive treatment for recurrent prostate cancer at Ronald Reagan UCLA Medical Center.
I was very happy when they said, you're a perfect candidate. And I says, good, let's do it.
Dwight had radiation treatment 22 years ago, but now his prostate cancer has come back, and he is not a candidate for additional radiation or surgery.
That left very few options, and I was afraid that it would start metastasizing and go throughout my body, and I wasn't willing to take that chance.
Dwight is undergoing a procedure called HIFU, High Intensity Focused Ultrasound. The treatment has been available in other parts of the world, but this is the first time HIFU is undergoing rigorous study at U.S. academic centers for approval by the FDA.
These are the same ultrasound waves that are used for taking pictures of babies when women are pregnant, except they're focused in a very precise way that the point where these waves are focused actually generates heat, killing the cancer cells.
Ultrasound provides an image of the prostate and a computerized roadmap for treatment. A high-intensity focused ultrasound beam then delivers bursts of intense heat, about 200 degrees Fahrenheit, 3 seconds at a time. Each application heats up or ablates about 3 millimeters of tissue, an area about the size of a grain of rice.
Even more than minimally invasive, it's essentially non-invasive. Nothing goes through the skin. We begin at the top and work our way down to the prostate, treating speck by speck by speck. We like HIFU in this situation because of its precision.
In less than 2 hours, Dwight's high-intensity focused ultrasound or HIFU treatment is complete. 3 months later, the early results are in.
He's doing fantastic. He went home the same day. He really had almost no pain, no side effects. When we checked his PSA, the PSA is a test that we use to monitor prostate cancer. His PSA was essentially undetectable.
The PSA had gone from 6.8 to 0.1, which is lower than it's been in the last 30 years.
Doctors know results like Mr. Baird's may not be typical, and side effects may also vary. Clinical trials now underway for HIFU will determine FDA approval. UCLA is the only center offering the trial on the West Coast. Dwight says he's happy he met the criteria. He and wife Judy will celebrate their 50th wedding anniversary this year.
Oh, it's wonderful. I mean, he's a healthy guy, and I want him to be around for a lot more years.
This nice man, Mr. Dwight Baird, in the video, came down from his home in Northern California to visit with us recently. PSA 0, undetectable PSA. His urinary control is perfect. He's a delighted survivor of prostate cancer, actually a cure. And he owes a lot to this new modality for resolving his his failure to respond to radiation therapy well. About a third of men who have radiation therapy for prostate cancer will experience a recurrence. This is an excellent treatment for them. Now, we have progressed to a comprehensive HIFU program at UCLA. This really began with our ability to find prostate cancer with MRI, because most of our patients that we will treat will be men interested in focal therapy of prostate cancer. Our MRI program at UCLA is superb. Our radiology department has done a fabulous job for us in terms of refining and perfecting MRI. We have used the MRI guidance to obtain targeted biopsies, so we know exactly where we're going when we biopsy the prostate. We can make precision biopsies, and then we use that information to translate the imagery into the HIFU machine so that we can do precision focal therapy. Uses the same software that we use in our biopsy program to use in our treatment program. It's called the Profuse software, and it is the same for both procedures. So we've had a very large experience with targeted biopsy, perhaps the largest in the United States. Some 2,500 procedures have been done using ultrasound fusion in the Artemis device here, and now we are translating that into our treatment program. So prostate MRI is the key for focal therapy. It's amazing how prostate MRI has evolved. This is one of the first images ever published with a prostate MRI using a very low power, non-powerful magnet, very low. You can hardly see anything there. And nowadays, the magnets are much stronger, and the definition within the prostate is much more perfect. This is so-called T2 weighted image, dynamic contrast image, diffusion weighted imaging, and these correlate very nicely with the actual cancer spot within the prostate. So MRI is the key to getting targeted biopsy and targeted treatment. Our experience with targeted biopsy at UCLA is among the largest in the world. This was 6 months ago, 2,200. It's now over 2,500, divided between men having their first biopsy, men who have a prior negative biopsy but persistently elevated PSA. They remain suspicious for prostate cancer. We're finding a lot of prostate cancers in this group of men and in our men who are electing active surveillance. We're using the new technology to be sure that we are surveying the right people. The total number of biopsy cores obtained with the new method is staggering, 33 or 35,000 now, about a quarter of them targeted and 3/4 of them taken by a template built into the software. This is our routine per patient, and we do believe that this is the best way to biopsy the prostate now. Many publications to show this. So when we do image fusion for prostate biopsy, as we will do image fusion for targeted therapy using HIFU, the MRI reader, the radiologist, shows us where the lesion is. We then fuse it in the Artemis device in the clinic under real-time ultrasound, target biopsy that area. This is done using this Artemis device. It was the first of the approved image fusion devices. We've had it installed at UCLA since early 2009. This is the 3D reconstructed model made of the prostate by the image fusion device. Each of these biopsy cores shown here is recorded in real time and tracked in 3 dimensions so that it can be followed. And if any one of these is problematic, we can go right back to that same spot and we can target. Brings the accuracy of MRI in that big tube into an office setting. So the results of focal HIFU treatment are something I'd like to call to your attention. This is the best study there is so far on this topic. We'll be doing our own studies on this. But my colleague at University College London showed in a recent publication that intermediate risk prostate cancers can be treated very successfully by ablating the index lesion, the primary tumor found. No serious adverse events, and in this group of 56 men, a 92% continence rate. Their urinary control was not affected, and 77% of them who were sexually active with erections prior to treatment remain active after treatment. And most importantly, in 86% of the men who were treated, no cancer could be found on follow-up biopsy. This is a wonderful new alternative for men with prostate cancer. This is the way the treatments can be done. If this is the tumor spot in red starburst here, we can either start here, a focal therapy, a quarter gland or quadrant ablation, a hemi-ablation where we can take out half of the prostate, or so-called hockey stick ablation of the prostate to get all the necessary areas. Notice this is the index lesion. Many of these little spots of tumor, the green spots, are of no consequence. Prostate cancer does exist in an inconsequential fashion, and we may or may not treat that. We have lots of options open to us with HIFU because of the precision and the ability to target tissue. The potential for the adaption, widespread adaption of HIFU is dramatic. As you know, conventionally, surgery and radiation have been the treatments for prostate cancer, but these are on the decline in the United States right now, according to the National Cancer Institute. Surgery and radiation will be used less and less, and only for the most aggressive tumors. Active surveillance is increasing. We're defining the eligible patients, but it will take a bigger and bigger slice of the pie, and focal therapy, which is just beginning, will become a possible alternative for as many as a quarter of the patients. Some 60,000 men a year may be candidates for focal therapy. These estimates are usually conservative. So our algorithm for management of prostate cancer from the 1980s up into the present was man gets a PSA test. If the biopsy, typically done blind, if a blind biopsy shows cancer, any cancer, surgery, or radiation. That was then. Now the algorithm, much more likely to be used, is selective PSA testing, targeted biopsy using MRI, ultrasound guidance, and then treatment will depend upon what kind of cancer it is. If it is a serious aggressive cancer, surgery or radiation will still be recommended. If it's a very non-aggressive cancer and a limited small amount of non-lethal prostate cancer, then active surveillance will be recommended. And for that large group of in-between patients, focal therapy will be recommended. And right now, HIFU is the best option for focal therapy. Who's eligible for HIFU? Men with intermediate risk prostate cancer who have an index lesion. If there's cancer all over the prostate, they're going to have the whole prostate gland removed. It may be a better candidate for surgery or radiation, but if there's one spot, excellent candidate for focal therapy. We'd like them to have a 10-year life expectancy or more. They need to have MRI targeted biopsy to define the lesion. They need to have an accessible prostate with no stones that could block the transmission of the ultrasound waves. And if the prostate is too large, this is not technically possible. This is an example of how stones in the prostate, shown here in the white, can constitute a contraindication to doing HIFU treatment. This is the rectal area where the HIFU probe goes. Prostate is here. And if we're trying to treat this spot here, you can see the transmission of waves into that tumor spot would be altered and blocked by the stones. So there are certain cases where HIFU cannot be done. Having said that, I think HIFU will be a very good option for many men with prostate cancer. We'll be happy to take your questions and happy to see interested men in consultation. Thank you very much. So we have a question here, is HIFU dangerous? So HIFU does require general anesthesia. If a man is not a candidate for general anesthesia, he can't have HIFU. will have to be cleared by his physician to be able to put to sleep and do this. As I showed you, the precision of this requires that the man remain motionless throughout this procedure, so deep general anesthesia is required. Now, having said that, the treatment itself is not a dangerous procedure. It's so precise. When you compare the options of surgery and radiation, the side effects of HIFU are minimal, and we do not think it's a dangerous procedure. I have another question here. How much does it cost? Does insurance cover it? And this is a bit of a problem now for many people. I showed you that 4,000 people paid, American citizens paid out of their pocket to go offshore and have this done. FDA has approved HIFU, and soon Medicare and the third parties are expected to reimburse for HIFU, but right now it is an out-of-pocket expense.